My name is Dr. Sarah Tabor, and I'm a pediatric rheumatologist at HSS. So I see children with autoimmune and inflammatory joint diseases. So typically from birth up to usually around 18 years of age for a new patient and around 22 or 23 for a patient I've been following. I treat diseases including juvenile idiopathic arthritis, lupus in children, dermatomyositis, scleroderma, fever of unknown origin, periodic fever syndromes. Some of the diseases that we see as pediatric rheumatologists present similarly to how they would present in adults, but in some cases they do present differently in children. Children do get fevers and viral illnesses and infectious diseases more commonly than adults do typically, so a lot of times the early symptoms of autoimmune disease may be missed in a child, may be assumed to be something else. A lot of pediatric rheumatology diseases are rare, and so doctors, including pediatricians, may not be familiar with them. When we treat a child with a chronic disease, we really think about the fact that we're treating someone who, may have this disease for 60, 70, 80 years. So it's really important for us to think, what are the long-term implications of treatment? How do we maintain function and assure that a child can grow into a happy and healthy adult? Unlike adults, children do have to grow, so we really have to take into account the side effects of medicines that we use. We really want to make sure that a child can interact with their peers and have normal social development, and that frequent visits to the doctor or hospitalizations don't prevent that from happening. At HSS, we have a dedicated pediatric floor where the patients come, and it looks really different from an adult medical floor. So it's bright, it's colorful, and all of the people who work there are really familiar with working with children and their needs. When a patient has a good response to medicine or to the treatment that I'm prescribing, it feels absolutely wonderful. So I've had patients who've come in unable to walk, unable to move, and after a few months of therapy can really get back to being kids, playing on sports teams, being in the school play, resuming living their life like normal, and it's the best feeling that there is.